Support Counselling Service. My name is Debbie Amor and I am the Counselling Service Coordinator. Counselling is a talking therapy and we offer short-term solution-focused therapy comprising of 6 weekly sessions via telephone or online using Zoom, and the sessions are 50 minutes long. A fully trained counsellor will give the carer a safe and confidential space to talk about their concerns, along with feeling listened to and feeling understood. The sessions are for carers to talk about the issues associated with their caring role, which might include stress, anxiety or depression, the loneliness that they're feeling, or bereavement, feelings of isolation, loss, exhaustion, guilt, or even resentment. There are often conflicting demands and emotions that carers face and experience, such as a change in relationship and role. Carers will be encouraged to look at changing their thinking and their behaviours to help them create strategies to cope with the situation they find themselves in, rather than getting bogged down in the details of the everyday problems. The support has helped some carers to feel more optimistic about their situation and feasibly carving out some time for themselves on a regular basis, or by being able to look at other options to help with care. Carers often report feeling more resilient and an increased confidence and self-esteem from being able to explore their situation with a counsellor. Counselling can bring up difficult thoughts and emotions. It can be challenging at times, and it's not always a comfortable chat. I tell carers to take time after each session to look after themselves and to process what has come up, and to be kind to themselves. Carers find that their mental health has improved and they feel more connected and less isolated than before they started their counselling sessions. To refer carers to our service, they must be over 18, live in Bristol or South Gloucestershire, and must not currently be receiving mental health support, such as counselling, group therapy, or CBT, for example. Carers must also be able to commit to 6 weekly sessions at the same day and time each week, and also have access to a private space for the duration of each session so they can talk freely and openly. Of course, we want the service to be available for all our carers, but in some cases our counselling service may not be appropriate for their needs. After all, 6 sessions of counselling is quite limited and not enough time to safely support carers with more complex issues such as post-traumatic stress disorder, complex diagnosed mental health conditions, childhood or other traumas that are not associated with their day-to-day caring role, or if carers are wanting practical advice on managing their cared for needs, also wanting advice on financial or legal disputes and issues.